Welcome back to Decoding AI for You, the 5-minute deep dive. Today, I want to take you inside a space that's complex, high pressure, and absolutely vital, hospital operations management, and explore how generative AI is quietly transforming how hospitals run behind the scenes. Now, when people hear generative AI, they often think of it creating text, images, maybe even chatbots. But in the world of healthcare, it's playing a much deeper, more practical role. Think optimizing patient flow, reducing admin work, managing capacity, forecasting resource needs, and even predicting supply chain issues before they happen. That's the kind of impact we're seeing. Let me break this down from the inside. When we talk about operations in a hospital, we're really talking about everything that keeps the place running, from patient admissions and discharge to staff scheduling, surgical equipment availability, and beyond. And in a system as complex as a hospital, there's very little room for inefficiency. Here's where Gen AI comes in. It's helping us reimagine these systems. For starters, it's being used to automate routine administrative tasks, scheduling inquiries, billing summaries, form entry into EHRs. This alone has been shown to cut nursing admin time by up to 46%. That's time given back to patient care. That's real. But it's not just admin. Gen AI is also supporting clinical decision-making, not replacing physicians, but enhancing them. It processes massive datasets, health records, diagnostics, literature, to identify patterns we might miss, helping tailor treatments based on what's worked for similar patients at scale. Then there's capacity management, one of the toughest operational challenges we face. AI allows us to forecast patient volumes, say before flu season, and adjust resources proactively. It even predicts when equipment like MRIs might need servicing to avoid unexpected downtime. And yes, Gen AI is helping with supply chain logistics too. It analyzes factors like weather, local outbreaks, and even traffic to predict inventory needs and shipping routes. Some hospitals are already using it to monitor not just their own inventory, but their suppliers' stock levels too, so they can spot disruptions early. It's impressive. And it's everywhere. Behind the scenes, Gen AI is streamlining internal workflows, optimizing staff schedules, managing department-level supplies, and highlighting operational bottlenecks. It does this by analyzing historical and real-time data, then recommending micro-adjustments that keep everything running smoother. I've seen hospitals use it to simulate operations, literally building digital twins to test how they'd handle patient surges or new department openings. That kind of foresight used to be unimaginable. Now it's part of how we stay ahead. And resource management? It's becoming smarter too. Gen AI models demand at the unit level: how many beds in cardiology on a Tuesday night, how many surgical kits on Thursday morning. It even auto-adjusts staff assignments based on real-time needs. That's not just smart. It's sustainable. But of course, data is the foundation of all this. High quality, consistent, and complete datasets make or break the effectiveness of Gen AI. And the tech is helping improve those datasets too, filling in gaps, spotting anomalies, and cleaning inconsistencies so our forecasts and decisions are as accurate as possible. Let's not forget the supply chain either. Gen AI isn't just optimizing within the hospital, it's rethinking how we work with external partners. By moving from transactional relationships to transparent, collaborative ones, hospitals are beginning to synchronize their supply chains to avoid shortages and reduce waste. Real-world examples are already emerging. The University of Rochester Medical Center is using Gen AI to improve patient engagement. Valley Medical Center is saving providers time by automating tedious admin work. OSF Healthcare is boosting predictive analytics for earlier intervention. Health First is even tailoring treatments using AI. And the results? Less waiting, better care, lower cost, greater efficiency. Still, this transformation isn't easy. Data privacy, system integration, ethical oversight, and transparency with patients all matter. We can't just plug in a tool and walk away. It takes governance, cross-functional collaboration, and responsible deployment. Looking ahead, the sources I've reviewed point to a few clear trends. First, personalized medicine will accelerate, driven by ever more detailed individual data and AI-powered predictions. Second, clinical documentation and operational forecasting will become increasingly automated and precise. Third, we'll see a new kind of AI-powered workforce, not replacing humans, but enabling them to work smarter with new tools. And supply chains? They'll become more sustainable too, as AI helps identify waste, optimize routes, and improve ethical sourcing. Here's the bottom line. This isn't just a story about hospitals. It's about what happens when you apply AI to deeply human systems. The complexity of healthcare is exactly why it's the perfect test case for AI-driven operations. If you're working in a hospital or any complex organization, this is your moment to think big. AI isn't just about future possibilities. It's already reshaping how we manage, respond, and deliver quietly, efficiently, and powerfully. If you're ready to take the next step, check out the resources in the description, which includes our deep dive report provides a detailed analysis on generative AI within your industry. And as always, stay curious, stay informed, and I'll see you in the next episode of Decoding AI for You. Thanks for watching Decoding AI for You. If you found this useful, don't forget to like, subscribe, and share. Let's keep exploring the future of AI together. See you next time.